Hello, everyone. It's such a pleasure to be with you here today. My name is Madeline LeBlanc, and I'm thrilled to speak with you about a topic that's very near and dear to my heart: doulas, the newest member of the hospital birth care team. Before we start, I'll tell you a little bit about myself. I have a master's in healthcare administration from LSU Shreveport, a bachelor's in nursing from Southeastern Louisiana University, and a bachelor's in biology from Belmont Abbey College. I'm a certified birth doula as well as birth doula trainer through the International Childbirth Education Association, and I am an internationally board certified lactation consultant. I've worked as a labor and delivery, postpartum, and NICU nurse, a nursing professor. I have worked both in community colleges and in universities, and have dedicated my entire career to improving maternal health outcomes. I founded Mary's Hands Network in 2023 to train and support community volunteers to be doulas in South Louisiana, and I'm actively conducting research to promote doula care and establish best practice for integrating doulas into the hospital settings. So I am thrilled to have the opportunity to share how transformational doulas can be for hospital births. Let's take a moment to understand the challenges we're facing in maternal and neonatal health, especially where I'm living here in Louisiana. Our state ranks fifth in the nation for maternal deaths and an alarming second for infant deaths. These statistics are a stark reminder of systemic issues, including disparities in access to care, high rates of medical intervention, and a lack of continuous labor support. These are the challenges which contribute to preventable complications: low breastfeeding rates, increased risk of low birth weight, and preterm births. To address these issues, we need innovative patient-centered solutions. Doulas offer a powerful answer, providing continuous personalized support to bridge gaps in care and improve outcomes for mothers and babies. Louisiana's maternal mortality rates are 4 times higher for Black women. 59% of Black maternal deaths between 2011 and 2016 were deemed preventable, compared to 9% of the white maternal deaths. Doula care can save lives. Let's go over what we're going to accomplish during the presentation. By the end of our time together, you should be able to understand the historical context of doula care and how that intersects with the current state of maternal and infant outcomes here in Louisiana, and then take that and relate it to your care in Tennessee. We're going to explore why these outcomes demand our urgent attention. Then we're going to discuss the impact of doula care on birth outcomes, which is backed by evidence, and it's going to show us how doulas can contribute to healthier mothers and healthier babies. We'll then review the role and the scope of practice of a professional doula and hopefully clarify what they do and what they don't do within the hospital care team. Finally, we'll evaluate some practical tips and some strategies for integrating doula care into your practice and helping you become a part of the solution in improving maternal health outcomes. To understand the role of doulas today, we need to explore their historical roots. While doulas in hospitals may seem like a modern concept, the idea of continuous support during childbirth has been around for centuries. Across cultures, childbirth was traditionally a community event, with women supported by family members and experienced caregivers who provided emotional and practical care. In the 20th century, the rise of the medical model of childbirth replaced this communal support with the clinical care. While this shift improves outcomes for high-risk pregnancies, it often left low-risk mothers over-medicalized and isolated from their natural support systems. Today, our increasingly fragmented society, made worse by the pandemic, has created a void in the kind of continuous support families once relied on. That's where modern doulas come in, bridging the gap between traditional care and modern medicine. Unlike the intervention-heavy medical approach, doulas provide the continuous care that most women need to give birth safely and confidently. They empower mothers, improve outcomes, and ensure a more positive birth experience. The pandemic further highlighted their importance. During this time, doulas were recognized as essential members of the care team, stepping in to provide critical support even when hospital access was limited. So doulas are not a new concept. They represent a return to the kind of personalized, continuous care that has always been essential for healthy births and strong families. The concept of doula care has deep historical roots, dating back to ancient Greece. In this era, women known as Maiai provided critical emotional and physical support to expectant mothers during childbirth. These women weren't medical practitioners, but their presence was invaluable. The Ma'ai played a vital role in ensuring that mothers felt comforted and empowered throughout the birthing process. They offered reassurance, practical assistance, and guidance during labor and delivery, creating an environment where women could feel safe and supported. Their work not only contributed to safer births, but also to more positive birth experiences, laying the foundation for what we now recognize as doula care. The ancient practice demonstrates that enduring importance of continuous, compassionate support during childbirth, a principle that remains at the heart of modern doula and obstetrical work. Childbirth has always been a deeply spiritual and communal experience for Indigenous Americans, with women playing central roles in guiding and supporting one another through this transformative journey. In many Indigenous cultures, childbirth is seen as a holistic process that connects the physical, the emotional, and the spiritual realms. Female relatives and elders provide both practical assistance and spiritual guidance, ensuring that the mother feels supported and empowered throughout the labor and delivery. One beautiful example of this is the blessing way ceremony. It's a sacred ritual that honors the expectant mother and invokes blessings for a safe and harmonious birth. Symbolism from the Indigenous medicine wheel often plays a role in the ceremony, guiding mothers through the stages of labor and into her new role as a mother. This reflects that interconnectedness of life cycles and the profound importance of community in the perinatal period. This approach underscores how deeply childbirth has been valued as a communal experience, with women supporting each other in ways that were both sacred and practical, a tradition that continues to inspire the work of doulas and other obstetrical healthcare workers today. Even in colonial America, women supported one another during childbirth in deeply meaningful ways, continuing that tradition of communal care. However, the early 1900s marks a significant shift as obstetrical care moved under the umbrella of medical practice. Between the 1940s and the 1960s, the use of twilight birth became widespread. This practice involves administering morphine and scopolamine to anesthetize laboring mothers. While addressing pain, for sure, this often left them disoriented and disconnected from their birth experience. In the 1960s, the epidural emerges as the safer and more effective option for pain relief, and it was considered a true lifesaver and a modern medical marvel for mothers. However, many of the impersonal and isolating practices associated with twilight birth still lingers even without it now that we have the epidural. So these practices included things like mothers laboring and birthing alone, separating babies from their mothers immediately after birth, discouraging breastfeeding in favor of formula feeding, or increasing the reliance on surgical interventions or now pharmaceutical interventions. While medical advancements undoubtedly are saving lives, they often come at a cost of the emotional and the physical connection during childbirth, which can leave many women without the support they need to thrive during this difficult and transformative experience. In the 1960s, Dr. Dana Raphael used the term doula, which originates from the Greek word meaning female servant. The story goes that in the late 1950s, while explaining her concept of maternal support to an elderly Greek woman, the woman responded, "That's a doula." Inspired by this, Dr. Raphael used the term in her 1966 dissertation on cross-cultural breastfeeding practices, and later popularized it in her book, The Tender Gift, Breastfeeding. Dr. Raphael redefined the term to describe an experienced woman who supports mothers after birth, particularly with breastfeeding. Her work not only gave us a name for this vital role, but also sparked the modern movement to integrate doula care into maternal health systems. In the 1970s, groundbreaking research by Dr. John Kennel and Dr. Marshall Klaus forever changed how we view the early moments after birth. Their studies highlighted the critical value of skin-to-skin contact between a mother and her baby during that first 90 minutes after birth. This, quote, baby-friendly environment was shown to promote bonding, reduce stress for both mother and baby, and support the development of lasting emotional attachment. As one article summarized, their findings concluded that close contact with within minutes of birth was essential for forming a lasting parent-child bond. This research reshaped maternity care practices worldwide, encouraging hospitals to prioritize early contact between parents and their newborns. Dr. Kennel and Dr. Klaus didn't stop there. Their work also demonstrated the transformative impact of doulas on birth outcomes. Women supported by doulas experienced fewer medical interventions, shorter labors, and more positive birth experiences. This evidence sparked a renewed appreciation for doulas, leading to the creation of formal training programs and professional organizations that continue to elevate this essential role. Their books, including Maternal Infant Bonding, Parent-Infant Bonding, and The Doula Book, remain foundational texts reinforcing the importance of bonding and doula care in modern maternity practices. The evolution of the doula's role marks a transformative shift in childbirth culture. Over time, we've moved beyond a purely clinical focus to embrace a more holistic approach that prioritizes both medical care and emotional well-being. By honoring the ancient traditions of continuous support and integrating modern research, doulas provide a unique bridge between the past and present. Their work creates a nurturing, personalized childbirth experience that improves outcomes for women worldwide. In the next few slides, we're going to take a closer look at the data behind these impacts, explore how doula care reduces interventions, improves maternal and neonatal health, and enhances the overall birth experience. The numbers speak for themselves, and they highlight why doulas are becoming essential members of the modern birth care team. This slide highlights just a few of the measurable impacts of doula care, so let's break it down. First, we see a 6.2% reduction in the risk of low birth weight. For vulnerable populations, especially those facing socioeconomic or health disparities, this can make life-changing differences. Next, there's a 9.2% reduction in maternal or newborn complications. These are outcomes that save lives and reduce long-term health challenges that are faced by both the moms and the babies. Doula care also decreases primary C-section rates by an average of 7.7%. With C-section births posing higher risk of complications and longer recoveries, this reduction is significant for both health outcomes, but also healthcare costs. Finally, there's a dramatic 26.5% increase in breastfeeding initiation during the hospital stay. And this is not just about nutrition. It's about fostering bonding, reducing infant mortality, and setting the stage for lifelong health benefits. These statistics are telling the compelling story that doulas are not a luxury or an add-on. They're a critical component of improving maternal and neonatal outcomes in every setting. Let's take a closer look at more recent data that reinforces the value of doula care. So this study is conducted across 3 U.S. states and provides some striking insights. One is that the C-section rate dropped significantly from 17.79 to 10.4%. That's a major improvement, reduces risk and recovery times for mothers. The preterm birth rates also saw a notable decrease, falling from 8.72 to 5.37. That's an incredible impact on neonatal health, especially as preterm births are the leading cause of infant complications. Emergency room visits or readmissions due to delivery complications decreased from 5.03 to 3.69%. And that shows that doula care can help prevent complications that would otherwise require more urgent interventions. Perhaps the most striking is the decrease in the postpartum anxiety and depression from 14.09 to 6.04%, which emphasizes that the emotional and mental health benefits of continuous, compassionate support during and after labor is impactful. This study illustrates the far-reaching impact that doulas have, not just on physical health, but also emotional well-being. It's another testament of how doulas are reshaping the birth experience for the better. Now, let's define what doula care looks like today. According to the International Childbirth Association, a doula is a trained professional who recognizes birth as a key life experience. They support the physical and emotional needs of women in labor while providing information to help a woman make informed decisions in conjunction with her healthcare providers. Doulas are experts in comfort measures, advocacy, childbirth education. They are there to empower women, helping them navigate their birthing experience with confidence and autonomy. From prenatal prep to postpartum care, doulas offer unwavering emotional support, ensuring mothers and families feel seen, heard, cared for throughout the journey. In short, doulas are bridging that gap between the clinical and the personal, bringing both expertise and compassion into the birth experience. Now let's shift our focus to the scope of practice for doulas and how they fit into the hospital birth care team. So doulas are non-clinical professionals, meaning they don't provide medical care or make clinical decisions. Instead, they focus on offering continuous emotional, physical, and informational support to mothers and their families during childbirth. This distinction is what allows them to complement the work of the nurses, the midwives, the physicians, rather than replace or compete with them. By acting as the bridge with the medical team and the birthing mother, the doulas help ensure that communication is clear and that the mother feels empowered to advocate for herself. This is going to foster that collaborative and supportive environment, which will enhance the birth experience for both the patients and the providers. Doulas bring a unique skill set to the hospital care team, and it complements the healthcare providers. First, doulas excel in providing comfort measures. This includes everything from helping with position changes, using a tub or a shower, adjusting the atmosphere with smells or music, changing the lights, guiding relaxation techniques like visualization and vocalization, or using tools like birth balls, peanut balls, massage to ease discomfort and help relieve pain. These non-clinical strategies can help make a significant difference in the laboring mother's experience. Second, doulas are a source of education and information. They provide resources, educate within their scope, such as childbirth preparation and breastfeeding support, and guide families towards trusted experts like lactation consultants or other specialists when needed. Advocacy is another key role. While doulas do not contradict healthcare providers, they do empower mothers to ask questions, clarify their preferences, and speak for themselves. This collaborative advocacy ensures that mothers feel heard while maintaining harmony within the healthcare team. Lastly, doulas connect mothers to vital support and resources. With knowledge of prenatal, labor, postpartum, and newborn care, as well as access to community services, they help mothers navigate challenges and get the assistance they need. By working in conjunction with the hospital staff, doulas enhance the overall care experience while respecting the expertise of the medical team. Now let's talk about the boundaries of doula care, what doulas should never do. These are important guidelines that maintain a doula's professional role and ensure that their contributions complement the work of the healthcare professionals. First, doulas never give medical advice. The difference between sharing information and giving advice is subtle but crucial. Information is objective. It provides facts, statistics, and neutral knowledge for the mother to consider. Advice, on the other hand, is subjective, often influenced by personal opinion or belief. For example, sharing evidence-based information about the benefits of certain birth positions is within a doula's scope of practice. Telling the mother which option to choose crosses into advice, which is not a doula's role. Second, doulas should never contradict a healthcare provider. Advocacy is about empowering the mother to ask questions, seek clarity, and to take an active role in her care plan. It stops short of questioning or undermining the provider's expertise. Advocacy means supporting the mother to communicate effectively, not acting as a voice in opposition to the care team. Finally, doulas should never perform medical or clinical tasks. If it's something you wouldn't expect the baby's father or another support person to do, it's likely outside the doula scope. This includes tasks like taking vital signs, administering medications, or making clinical assessments. By respecting these boundaries, doulas ensure that they remain valuable members of the birth team, fostering collaboration and trust while empowering the mother to take charge of her own experience. Let's begin the process of integrating doula care into practice by starting with some self-reflection. So if you're going to have or be working with doulas in your practice, you need to ask yourself, what is your current experience with them? Have you worked with them before, or is this a brand new concept for you? Take a moment to examine any prejudices or biases you may have towards doulas, and this can include both positive and negative impressions you might hold, because identifying these is going to help ensure a fair and balanced perspective. Ask yourself, are you open to involving a new member into the care team? Adding a doula means collaboration, so openness is part of the partnership. Finally, how comfortable are you with adding another member to the care team? Consider how this might affect team dynamics, communication, workflow. So by reflecting on these questions, you can identify areas for growth and set a stage that'll foster the collaborative relationship with the doula in a way that benefits both the care team and the mother. Now let's focus on getting to know the doula. First, you want to understand their experience and their skills. What are their goals for the birth, and how do those goals align with the patient's, and how do those goals align with your goals? At the end of the day, the doula is here for the same reason that you're going to be there: is to give that patient the best possible birth experience. So take this opportunity to educate yourself on best practice for collaborating with doulas. If this is your field, that's wonderful, but keep in mind that it's also going to be the doula's field. So working together starts with a mutual respect of shared knowledge and knowing that when we align as a team, the patient wins. Let's bring it all together. Start by determining the patient's goals for the shift. This ensures everyone is aligned and working toward what the patient envisions for their birth experience. Next, create an interdisciplinary care plan that includes the doula. Collaboration is key. Integrating the doula into the care team strengthens support for the patient. Establish boundaries for the doula based on the patient's status. These boundaries should be flexible and evolve as labor progresses. For example, can the doula assist with moving the patient, using tools like the peanut ball or rebozos, or providing comfort measures like massage, essential oils, or access to the shower or tub? Evaluate and adjust as needed. Labor is dynamic, and your approach should be too. When the care team, including the doula, works together seamlessly, the patient experience is elevated. As we come to the end, let's take a moment and reflect on the immense strength and resilience of women in childbirth. Birth is not just a medical event. It's a powerful, transformative experience. It requires teamwork, strategy, and support. The mother is at the center. She is the owner of this team. She holds the vision, the purpose, and the ultimate stakes. It's her journey, and everything we do revolves around her. The providers, whether doctors or midwives, are the head coaches. They develop the strategy, make the critical calls, oversee the big picture, but they never forget who they're working for, the mother, the owner of the team. Nurses are the quarterbacks, executing the strategy, making real-time adjustments, and leading the on-ground action. Their role is crucial, but no quarterback can succeed without a solid offensive line. That's where doulas come in. They're the offensive line, the unsung heroes, protecting and supporting every move the quarterback makes. They don't call the plays, but their impact is undeniable, creating a space for the birthing process to unfold as safely and smoothly as possible. Ancillary staff are like special teams, stepping in with precision when the situation calls for their expertise, adding strength and value at key moments. When the entire team is in harmony, aligned in purpose, and committed to the mother's goals, we achieve birth excellence. Every role matters. Every person contributes. Together, we elevate the experience of birth, creating outcomes that honor the power of women and the importance of their care. So let's take what we've learned today and work together to build a birthing environment where every mother feels supported, every baby is safe, and every team member plays their part to perfection. Thank you so much for your attention and engagement today. This concludes my presentation, but the conversation doesn't have to end here. If you're interested in learning more about doula care, participating in our research and collaboration, or exploring how Mary's Hands Network can support your practice, I encourage you to reach out. You can email me directly at mleblanc@maryshandsnetwork.org or visit our website at maryshandsnetwork.org. Whether you have questions, ideas, or simply want to join in advancing birth excellence, I would love to hear from you. Together, we can create meaningful change in maternal and neonatal care. Thank you again, and I look forward to connecting with many of you in the future.